Did you know that by the time you finish watching this video, approximately 20 seniors will receive a devastating dementia diagnosis? That's one person every 66 seconds. But here's what should really terrify you. What if the root cause isn't getting older? What if it's sitting right there in your medicine cabinet? You've been reassured these pills are safe, routine, even necessary for your health. But groundbreaking new research is raising serious red flags. 99% of seniors have absolutely no idea that at least one medication they're taking every single day could be shrinking critical memory centers in their brain by more than 28% in less than 12 months. Let that sink in for a moment. I know this sounds scary. I am Dr. Michael Kent. Let me tell you something. I've seen it happen too many times in my practice. People trust their medications completely. They assume if a doctor prescribed it, it must be harmless. Meanwhile, the pharmaceutical industry has known about these devastating effects for decades, yet they continue profiting billions of dollars from selling the exact same drugs that may be accelerating cognitive decline in millions of seniors across the country. In fact, a 2023 study published in Neurology and Aging Research discovered that one particular class of medications increased dementia risk by 49% in seniors within just 2 years of regular use. That's not a small increase. That's nearly half again the normal risk. In this video, I'm going to reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from commonly overlooked to absolutely mind-destroying. And number 3 on this list, it's prescribed to millions of seniors for something that seems completely harmless, but it can shrink key memory centers in your brain, and you probably don't even realize it's happening to you right now. Before we dive deep into this crucial information, I want to hear from you. Let me know in the comments section below. What medications are you taking every single day? And have you ever experienced sudden brain fog or unexplained forgetfulness after starting a new prescription? We're reading every single comment and replying with personalized insights based on your specific situation. Don't stay silent about this. Speaking up could literally save your mind. Now, without any further delay, let's start at number 9. And don't let its position on this list fool you for a second. This medication is sitting in almost every senior's medicine cabinet right now. It might be scrambling your brain before you even feel the first symptom. Number 9 is diphenhydramine, commonly sold as Benadryl. Diphenhydramine is that familiar pink pill that millions of people trust to help them fall asleep, relieve seasonal allergies, or ease cold symptoms. It's inexpensive, available over the counter at any drugstore, and you probably have a bottle of it in your nightstand or bathroom cabinet right this very moment. You may think you're simply taking it to sleep better at night or get relief from allergies, but inside your brain, Benadryl is actively disrupting your hippocampus. That's the specific region responsible for forming and storing new memories. Benadryl belongs to a family of drugs called Anticholinergics, which work by blocking a crucial neurotransmitter called acetylcholine. This is the chemical messenger that helps your brain create new memories and maintain alertness throughout the day. As your brain ages, it becomes increasingly dependent on every bit of acetylcholine it can produce. And when medications like Benadryl interfere with that delicate process, the results can be absolutely devastating. According to a 2023 study published in the Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs on a regular basis had a 54% higher risk of developing dementia compared to those who avoided these medications entirely. That's more than half again the normal risk just from taking what most people consider a harmless sleep aid. So how can you protect your precious memory? First and foremost, avoid anything containing diphenhydramine, especially if the label says PM, nighttime, or allergy relief. These products are often just Benadryl hidden under a different name, and if you're currently using diphenhydramine for allergies, there are much newer, non-sedating options available like loratadine, which is commonly sold as Claritin. These newer antihistamines do not cross the blood-brain barrier and are dramatically safer for long-term use in seniors. Never stop any medication abruptly without medical guidance, but also never assume that over-the-counter automatically means safe for your brain. Up next is a medication that's often marketed as harmless and gentle on your digestive system, yet it systematically interferes with the very nutrients your brain desperately needs to stay sharp and healthy. Number 8 is proton pump inhibitors, specifically Prilosec and Nexium. These medications belong to a drug class called proton pump inhibitors, or PPIs for short. These drugs are specifically designed to reduce stomach acid production and are frequently prescribed for heartburn, GERD, and acid reflux problems. Many seniors remain on these medications for years, sometimes even decades, because their uncomfortable symptoms return immediately as soon as they try to stop taking them. But what's rarely discussed with patients is how PPIs systematically interfere with the absorption of vitamin B12, which is an absolutely crucial nutrient that protects brain tissue and supports memory function, focus, and mood stability. In a groundbreaking study from 2016 published in JAMA Neurology, researchers carefully examined over 73,000 people aged 75 and older. They discovered that regular PPI users had a 44% increased risk of developing dementia compared to people who didn't use these medications. By suppressing stomach acid too aggressively, PPIs interfere with your body's natural ability to absorb not just B12, but also magnesium and calcium, which are essential minerals for neural transmission and proper brain cell signaling. Without adequate levels of these nutrients, your neurons struggle to fire efficiently, causing misfiring, confusion, and memory lapses that often look exactly like the early warning signs of Alzheimer's disease. But the problem goes even deeper than nutrient depletion. PPIs have also been scientifically shown to increase levels of amyloid beta plaques in the brain. These are toxic proteins that actively disrupt normal brain function and are considered one of the core drivers of Alzheimer's disease progression. The excellent news is that there are much safer alternatives available. If you're using a PPI every single day, ask your doctor whether you can slowly taper off with the help of H2 blockers like famotidine, which is sold under the brand name Pepcid. While not perfect, H2 blockers are significantly less likely to interfere with cognitive function. Also, chewing a bit of deglycyrrhizated licorice, which is a natural compound that coats and soothes your stomach lining, can offer symptom relief without causing any cognitive harm whatsoever. Next up is a medication that's often prescribed for bladder control issues, but it may actually be wreaking absolute havoc on both your short-term memory and your emotional balance. Number 7 is bladder control medications, specifically oxybutynin. Oxybutynin, which is sold under the brand name Ditropan, is frequently prescribed to seniors who struggle with urinary incontinence or overactive bladder problems. On the surface, it seems like a practical and helpful solution. Nobody wants to deal with the embarrassment or inconvenience of frequent, urgent bathroom trips throughout the day. But this medication works by blocking acetylcholine, which is the exact same critical brain chemical that's disrupted by Benadryl. And unlike some milder anticholinergic medications, oxybutynin crosses the blood-brain barrier very easily and directly affects memory regions in your hippocampus. That characteristic makes it particularly dangerous for seniors, especially when it's used over extended periods of time. In a comprehensive 2019 study published in the British Medical Journal, researchers discovered that people over 65 who took strong anticholinergic medications like oxybutynin for more than 1 full year had a 49% higher risk of developing dementia. That's nearly 1 in every 2 users. What makes this even more concerning is that the vast majority of seniors are never properly warned about these serious cognitive side effects. They're simply told the medication will help control their bladder, not that it may be accelerating mental decline with every dose. The cognitive harm is often mistaken for normal aging. Patients commonly describe feeling mentally foggy, forgetting important appointments, constantly misplacing everyday items, or suddenly struggling to keep track of simple conversations. It's rarely connected back to the medication until significant damage has already occurred. So if you're currently taking oxybutynin and you've noticed any mental changes whatsoever, it's not just in your head, and you absolutely don't have to stay on this particular drug to maintain bladder control. Fortunately, there are much newer medications available like mirabegron, which is sold as Myrbetriq. This medication works through a completely different mechanism in your body and has shown significantly less impact on memory function. These newer drugs don't block acetylcholine at all and are generally considered much safer options for older adults who need bladder control support. Number 6 is statins. Statins are among the most widely prescribed drugs in the entire world, especially for people over 60 years old. They're intended to lower cholesterol levels and reduce your risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the two most commonly prescribed versions. But here's where the serious problem begins. Cholesterol isn't just a heart health issue, it's an absolute brain necessity. Your brain is composed of nearly 60% fat, and cholesterol plays a critical role in creating and maintaining the myelin sheath. That's the protective coating that helps nerve signals travel smoothly and efficiently throughout your brain. When you aggressively lower cholesterol with powerful medications, you may also be starving your brain of exactly what it needs to function properly. In a 2023 study published in Frontiers in Aging Neuroscience, researchers found that seniors over 70 who had been taking statins for more than 3 years straight had a 26% higher risk of mild cognitive impairment, and those taking high-dose statins had even more noticeable declines in mental function. What's even more alarming is that some patients reported sudden onset memory loss, describing frightening moments where they couldn't recall familiar names, recent conversations they'd just had, or even driving routes they'd traveled for years. Now, it's absolutely important to understand that not all statins affect the brain equally. Some medications like pravastatin and rosuvastatin do not cross the blood-brain barrier as easily and are considered significantly less risky in terms of cognitive side effects. If you've been on a statin for years and you're noticing mental fog, increasing forgetfulness, or growing confusion, it might be time to have a serious conversation with your doctor about either a dose reduction or exploring an alternative cholesterol management strategy. Don't wait until the damage becomes irreversible. The earlier you take decisive action, the better your chance of protecting your mind for all the years to come. Number 5 is benzodiazepines. Benzodiazepines, which include commonly prescribed drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax, are some of the most widely prescribed medications in America for anxiety disorders and sleep problems. They work by enhancing GABA, which is your brain's natural calming chemical that reduces overstimulation and nervous system activity. At first, these medications seem like absolute lifesavers. They quiet racing thoughts, ease panic attacks, and help with falling asleep at night. But over time, these drugs transform into something else entirely. They become a trap you can't escape. A 2022 study published in the British Medical Journal followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting benzos like diazepam, which remain in your body much longer and accumulate in fatty tissues, including your brain tissue. What happens is a kind of chemical sedation that progressively slows down neural activity throughout your brain. That means your brain stops learning new information as quickly as it should. It becomes less flexible, less efficient, and increasingly prone to confusion, memory gaps, and emotional numbness. Seniors taking benzodiazepines regularly often describe feeling like they're moving through a constant fog, feeling disconnected from reality, or just not feeling like themselves anymore. And the absolute worst part is when they try to stop taking the medication, withdrawal symptoms like severe anxiety, agitation, and debilitating insomnia can be absolutely brutal, making the drug feel absolutely essential when it's actually the primary source of the problem in the first place. To correct this dangerous situation, here's exactly what you need to do. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly under any circumstances. This can be genuinely dangerous and even life-threatening. Instead, work closely with a knowledgeable doctor to very gradually taper the dose down over weeks or even months. Safer alternatives like buspirone, which is a non-sedating anti-anxiety medication, or cognitive behavioral therapy specifically designed for insomnia and anxiety disorders, can help restore calm and peace without causing progressive memory loss and cognitive decline. Number 4 is amitriptyline, sold as Elavil. Amitriptyline, which is sold under the brand name Elavil, is an older antidepressant that's still surprisingly commonly prescribed today for chronic pain conditions, insomnia, and sometimes even migraine prevention. At first glance, it may seem like a versatile, multi-use miracle pill that solves several problems at once. But underneath the surface, it's actually one of the most potent anticholinergic medications still in widespread circulation today. That means it powerfully blocks the action of acetylcholine, which is the chemical messenger that helps neurons communicate with each other, form new memories, and maintain mental sharpness. In fact, it blocks acetylcholine so strongly that cognitive effects aren't just possible side effects. They're essentially expected consequences with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers carefully examined over 3,400 adults aged 65 and older. They discovered that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. That's not just a slight increase in risk, that's more than half again the normal risk of dementia. What's absolutely terrifying is that the vast majority of these patients were never told that this drug could actively harm their memory function. They were often prescribed amitriptyline for sleep problems or nerve pain, and then slowly started noticing troubling changes like short-term memory loss, word-finding difficulties, and increasingly foggy concentration. It doesn't even require a high dose to cause serious problems. Even low-dose amitriptyline taken nightly over several years can create a slow, invisible erosion of brain power that happens completely silently. The damage occurs without warning. No clear symptoms at first, just a gradual decline that looks exactly like normal aging, but is actually drug-induced cognitive impairment that could have been prevented. So if you or a loved one is currently taking amitriptyline, speak with your physician immediately about safer alternatives. For nerve pain, options like duloxetine or gabapentin may offer equivalent relief without carrying the same level of severe anticholinergic burden. For sleep problems, melatonin or very low-dose doxepin, which has a much milder anticholinergic profile, can be used instead with far less risk. And for mood support, there are much newer antidepressants available like sertraline or escitalopram that are generally considered dramatically safer for long-term brain health. Number 3 is paroxetine, sold as Paxil. Paroxetine, which is sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety disorders. At first glance, it appears to be a modern, sophisticated antidepressant, one that's supposed to be gentler and safer than the older generation of psychiatric drugs. But here's the critical part they rarely tell you about. Paroxetine is the only SSRI medication that has significant anticholinergic properties, which means it interferes with acetylcholine in your brain. That one crucial detail makes it drastically and fundamentally different from its SSRI siblings like sertraline or escitalopram. In a large 2021 comprehensive review published in Frontiers in Psychiatry, researchers examined the cognitive profiles of elderly patients taking different SSRI antidepressants. They found that paroxetine users showed measurable declines in short-term memory, verbal recall ability, and attention span within just the first 12 months of treatment. The study also discovered that seniors taking paroxetine were 30% more likely to show early warning signs of cognitive impairment compared to those taking other common antidepressants. The cruel irony is that paroxetine is often prescribed specifically to stabilize mood and reduce anxiety, yet it ends up systematically undermining mental clarity and emotional regulation over time, defeating its own purpose. The fix here is straightforward but absolutely essential for your brain health. Avoid paroxetine entirely in seniors. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, which is a carefully compiled list of medications that are potentially inappropriate for older adults due to safety concerns. If you're currently taking it, ask your physician about switching to much safer alternatives like sertraline or escitalopram, which are significantly better tolerated and don't carry the same serious cognitive risks. In addition, supplementing with B vitamins, especially vitamin B12 and B6, can help support mood naturally and may reduce your overall need for antidepressant medications. Number 2 is antipsychotics. This one is especially alarming and disturbing because many seniors don't even realize they're taking an antipsychotic medication. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed and approved to treat severe psychiatric conditions like schizophrenia and bipolar disorder. But today, they're frequently prescribed off-label to elderly patients for common sleep problems, mild agitation, or behavioral changes associated with dementia itself. That's right. These are powerful drugs that were designed for severe psychiatric illness, but they're now being routinely used in nursing homes and hospitals for seniors who are simply confused, restless, or difficult to manage by staff. The consequences of this practice are absolutely devastating. In 2022, a comprehensive study published in the Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors who were prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within just 12 months, even if they had absolutely no prior history of dementia before starting the medication. Even worse, these dangerous drugs dramatically increase the risk of stroke, sudden cardiac death, and severe sedation, which can directly lead to falls, emergency hospitalization, or permanent institutionalization in a nursing facility. The mechanism behind this damage is brutal and direct. These medications aggressively suppress dopamine, which is a chemical that's not only intimately linked to mood and motivation, but is also absolutely critical for executive function and memory processing in your brain. When dopamine levels crash dramatically, your brain becomes sluggish, slow, and unresponsive to stimulation. This is exactly why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Their personalities seem to fade away, and family members find themselves grieving for someone who's still physically present but mentally and emotionally absent. Correcting this tragic situation starts with asking hard, direct questions. If you or a loved one is currently taking one of these powerful medications, ask the prescribing doctor why it was prescribed in the first place and whether it's truly medically necessary or just being used for convenience. In the vast majority of cases, behavioral symptoms can be effectively managed with non-drug interventions like creating structured daily routines, reducing environmental noise and overstimulation, addressing underlying pain or physical discomfort, and dramatically improving lighting and sleep hygiene. When medications are absolutely necessary, using the lowest possible doses for the shortest possible periods can significantly reduce harm. But more often than not, these drugs are being used out of pure convenience for staff, not genuine medical necessity for the patient. The real tragedy is that many families are never even told what these drugs actually do to the brain. They just watch their loved one rapidly declining without ever knowing the cause is chemical, not natural aging. Number 1 is anticholinergic polypharmacy. This is the hidden danger that almost nobody talks about, and it's genuinely one of the biggest contributors to drug-induced dementia in the elderly population. You may have been expecting a single specific drug to top this list, but the most dangerous medication situation for rapid dementia in seniors isn't one particular pill. It's the silent, creeping, cumulative effect of taking multiple medications with anticholinergic properties at the exact same time, a dangerous situation that medical professionals call anticholinergic polypharmacy. Imagine this all too common scenario. A senior takes diphenhydramine every night for sleep, oxybutynin daily for bladder control issues, and amitriptyline for chronic pain management. Each medication alone might cause only mild, barely noticeable memory problems. But when you take them together, they compound exponentially, and the cumulative anticholinergic burden on your brain absolutely skyrockets. This isn't just a theoretical concern or academic worry. In a 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the normal risk. And here's the absolute worst part of this situation. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. Nobody had ever explained this to them. When you block acetylcholine from multiple different angles simultaneously, your brain doesn't just slow down temporarily. It begins to actively decay and deteriorate. Neurons physically wither from chronic underuse, synapses shrink and disappear, and your brain enters a hypoactive state that looks nearly identical to Alzheimer's disease on cognitive testing. Correcting this dangerous situation doesn't require a miracle cure or expensive treatment. It simply requires a thorough, comprehensive medication review. Ask your doctor or pharmacist to carefully evaluate your complete list of prescription medications, over-the-counter drugs, and even supplements for their anticholinergic load. There are online tools and professional software programs available that can calculate your cumulative anticholinergic burden score. Once the problem medications are identified, you can work systematically to deprescribe, slowly and safely tapering off unnecessary medications, switching to safer alternatives whenever possible, and rebalancing your brain chemistry naturally. This is honestly the most empowering part of this entire video. Drug